Welcome to Concept in Medicine. Guess what? Today is World Tuberculosis Day. We are going to be looking at medical facts about tuberculosis. Let's begin. Tuberculosis is a multi-systemic disease, meaning it does not only affect the lungs, as seen by a lot of people. It can also affect the brain, it can affect the kidneys, it can affect the bones, it can affect the ovaries and the testes. It can also affect the adrenal glands and the lymph nodes as well. We should know that tuberculosis is caused by a bacteria known as Mycobacterium tuberculosis. And this bacteria was discovered by the German bacteriologist Robert Koch. Because of that, tuberculosis is also referred to as Koch's disease. The bacteria was discovered by Robert Koch on 24th March 1882. That is why today is the World Tuberculosis Day, meaning that for every 24th March of every year, there will be a celebration of the World Tuberculosis Day. Tuberculosis is also transmitted by air droplet spread from one infected person to a healthy individual. Tuberculosis has two forms of presentation. It can present without symptoms and it can present with symptoms. If it's not presenting with symptoms, then we'll say that is a latent tuberculosis infection. If it's presenting with symptoms, then we call it an active tuberculosis infection or an active tuberculosis disease. If it is presenting with symptoms, what should you look out for? Let's take an example of symptoms that can come from a pulmonary tuberculosis. That is the tuberculosis of the lungs. We can think of fever, chills, anorexia, cough, which is usually chronic, more than or equal to 3 weeks. Initially, it may be dry and later become productive, which will come with purulent sputum or blood. And when it's coming with blood, then we call that hemoptysis. A person infected with pulmonary tuberculosis may also experience weight loss, may have anorexia, sometimes may have chest pain. Who are those at high risk of tuberculosis? We can put this into two categories. The first category, those who have been recently infected with tuberculosis. That is, they may get it upon close contact with people who are actively infected with tuberculosis. And the second group are those with underlying medical conditions such as HIV/AIDS, cancers, diabetes mellitus, renal disease, and so forth and so on. For the screening test, we can talk about the Mantle test, or what is also known as the tuberculin skin test. This particular test requires the use of a special protein we call purified protein derivative. This protein is injected into the skin and the reactions are observed after 48 to 72 hours. If it is positive, meaning further tests will have to be done to confirm the disease. If it's negative, it means you do not have the disease, but in some cases it may be a false negative. Then the other screening test, we call it the T-spot TB test. This particular one uses blood and is indicated for those who have received the tuberculosis vaccine. That is the Bacilli BCG, usually given at birth, on the day 0 of birth. Let's move ahead and talk about a diagnostic test. For the diagnostic test, we can talk about the sputum for acid-fast bacilli, sputum culture, and the sputum culture is considered as the gold standard of investigation. But the only problem is that it takes a longer time for the results to be ready. It may take 2 to 4 weeks. And the sputum culture is done using a particular special medium. We call it the Lowenstein-Jensen medium. There are two types. We have the liquid medium and the solid medium. The liquid medium will take 1 to 3 weeks for the report to be ready. The solid medium will take 4 to 8 weeks for the report to be ready. Another test we can think about is the gene expert. For the gene expert, it's a rapid nucleic acid amplification test that gives the diagnosis of TB and can also be used to test for drug resistance in TB, especially for rifampicin. A chest x-ray can also be done to look out for the signs of tuberculosis. Let's talk about the treatment for tuberculosis. For the treatment, the DOTS is used. And what does DOTS stand for? It stands for Directly Observed Therapy Short Course. And it's made up of 2 phases. The intensive phase, which takes 2 months, and the continuation phase, which takes at least 4 months. Let's talk about the drugs for the treatment of tuberculosis. The first line drug and the second line drug. The first line drugs we can think of RIPE, that is rifampicin, isoniazid, pyrazinamide, ethambutol. Then the second line drugs we can think of streptomycin, fluoroquinolones, and the injectables. For the injectables we can think of kanamycin, amikacin, and capreomycin. So those are the drugs that are used for the treatment of TB. But mostly the first line drugs will go first. And there could be resistance to these medications, which we will talk about in another video, where we'll be talking about the drug resistant TB, the multi-drug resistant TB, and the extensively drug resistant TB. Then the question goes, how then can one prevent tuberculosis? If you are diagnosed of TB, it means that you should stay away from crowded areas, you should stay away from closed environments, you should take your medications as prescribed, and also you should make sure you are not sleeping in the same room with your family. You are isolated. Also, make sure to cover your mouth when coughing, talking, or sneezing to avoid the spread of the Mycobacterium tuberculosis bacteria. That is for those who are infected with tuberculosis. Someone will ask, what can I do to avoid missing my tuberculosis medications? So for that particular one, maybe there's a particular thing that you do every day. You can use that particular thing as a guide. Maybe brushing teeth, you can use that as a guide to taking the medication. These are the medical facts about tuberculosis, and your guess is as good as mine. Today is World Tuberculosis Day. My name is Dr. Del, and this is Concept in Medicine. Bye-bye.